Want to know how to stop snoring and manage sleep apnea? I'm Dr. Ataii, and welcome to SleepArchitx's educational series on snoring. That's right, last time we talked about what is snoring. Today, we're going to talk about how to prevent, treat, and hopefully get you better. In order to get the right treatment, you first must be tested. Please contact us so we can direct you to a SleepArchitx's dental provider today. After you get tested, it's very important for you to start treatment immediately. So the first option is a CPAP. Stands for Continuous Positive Airway Pressure. What does that mean? Well, air is being pressed down through your nose, through your mouth, into your lungs so that you don't choke and die at night. That's right, your tongue can block the airway, and that continuous positive airway pressure stops you from the apneic events. Another option is surgery. What does surgery do? Well, remove the soft tissue that blocks the airway, like your tonsils, uvula, even some parts of the back of the throat. As far extreme as even tying your tongue to the bone called hyoid. Why is that important? Well, guess what? The tongue is the reason why it's blocking the airway, so the surgical approach is another option. A little scary for me. And yet another option is a customized sleep oral appliance. Your dental practitioner can make these for you, easy to clean, stops your mandible from dropping back, blocking the airway, you can travel with it, and yes, it is much easier than the other alternatives. Also, you're getting oxygen at night when you sleep, needed to boost your immune system to fight the viruses we see today like COVID. All right, here's my options, the oral appliance. Oh! Is my tooth still there? Yeah, it's there.